My name is Sandy Howell, and I'm the community educator for HICAP, which stands for Health Insurance Counseling and Advocacy Program. So we're going to go through today a few PowerPoints that I have some information, and then I'm going to provide you with some additional information and some CMS updates, and then we'll do some question and answers towards the end. So that will be great. So we're ready to go, and I am excited about this being right at lunchtime on Wednesday. So here we go.
Thank you so much. And just as a reminder, you can also enter any questions that you may have in the chat box. And this video is being recorded, so you can find our video here at Community Hospice YouTube channel.
Also have available at the HICAP office, and I'll tell you where we're located, is we call it the Senior Information Line, that provides you with phone numbers for different agencies that is very helpful for people that are on Medicare or are actually seniors. The HICAP office is located at 3500 Coffee Road. It's Suite 19. And it is in the Marie Callender's Walgreens Shopping Center right there on Stanford and Coffee Road. So we're in the back, and we are open Monday through Friday from 8 to 4:30. And I know a lot of people are learning about open enrollment, which is October 15th to December 7th. I was going to talk about that in just a few moments. And you will probably be getting a lot of calls, and then you want to be able to compare your plans and compare your prescription drug plans. And the way to do that would be to make an appointment at the HICAP office, and you can come in. We provide unbiased information for you, and we don't sell anything, so you can actually make an appointment by calling 209-558-4540. So that's very important. He's here to help. Okay, thank you. He said to move these keys to do this presentation, and that's not working.
That's not working.
Nope, that's not. Sorry.
No worries. Go ahead and try one key now. There you go.
Oh, so just the.
You're good.
I'm good. Okay. I think we're good with the PowerPoint. So HICAP can help. If you're turning 65, you need Medicare, and the picture at the bottom of that screen is what a Medicare card looks like. It has your name, an assortment of letters and numbers for your identification, and it has the date you were first eligible for Part A and Part B. So who gets Medicare? If you are turning 65 or you're disabled, Medicare is the federal health insurance program. And it is for people who are 65 or older, or people with permanent disabilities, and for people with end-stage renal disease or ALS. Why are you enrolling on this time is important. You could face penalties. If you don't enroll in Part B when you're first eligible, you could actually have a penalty. And if you decide not to get your Part D, there are penalties for that also when you don't enroll when you're first eligible. Can I make changes later? As I mentioned just a few moments ago, the annual open enrollment period is October 15th to December 7th. There's an additional open enrollment period if you're on a Medicare Advantage plan from January 1st to March 31st. You have one more opportunity to change a plan. Now, special enrollment periods are for people that have specific chronic health conditions, they lose coverage, they may be moving, or you have a different times that you can change plans if you're Medi-Cal and Medicare. Here briefly is the parts of Medicare. We often get this question, and it is kind of confusing. There's Part A, B, C, and D. And Part A is inpatient hospital insurance. And as people worked, they paid into Social Security, so your Part A is free. Your Part B is outpatient medical insurance when you see the doctor or you need medical supplies. And of course, Part C is Medicare Advantage, which is optional, and we'll explain that in just a moment. Now, Medicare Part D is prescription drug coverage. So if you have a Medicare Advantage plan, your prescription drug coverage is included. Medicare alone, we have found out, is not enough. You're going to need additional coverage to help pay for the part that Medicare doesn't cover. Original Medicare A and B only pays about 80% of actually what it allows. So if you only have Medicare and you'll be paying annual deductibles, and you will need a prescription, which would be a Part D plan. So if you have Medicare by itself, you will need a prescription Part D plan. Now, here's some of your options. How are you going to cover what Medicare doesn't cover? Medicare alone and Part D pay additional costs. So you could have Medicare with a Medicare Advantage plan if you don't have Medicare alone and Part D, or you can have Medicare with a Medigap plan, but you will need a prescription drug plan. You could have an employer retiree plan and Medicare. You could have Medicare and Medi-Cal. You could also have Medicare and TRICARE or CHAMP VA. So there's a lot of options. It's important to find out what your options are. Which is better, a Medicare Advantage plan for you or a Medigap plan? They're also called Medigap plans, supplemental plans. So we'll talk about that in a moment also. There is no one plan that is going to work for everyone. You know, what your neighbor has or a family member has may not be what works best for you. It's a matter of what is important to you. What is the most cost effective for you and what are your priorities? If you make an appointment at the HICAP office and meet with our counselors, the first thing we're going to say is if you want to keep your doctor, be very careful if you're changing plans from one to another. If it's important to you to keep your doctor, you want to know what plans that he takes. So you have a choice of hospitals, doctors, and overall cost. And you want to know if I travel, what are my benefits going to be? So a Medicare Advantage plan is what they call Part C. This may be more affordable. It has sometimes lower, no additional premiums. It does include a prescription drug coverage. And there are additional benefits like transportation, dental, and vision. And you can see that on the slide, but you are restricted with the provider network. So you are limited to the doctors and hospitals that are on that Medicare Advantage plan. And you will have coverage for emergency if you are out of state or leave the area. So that are some of the advantages of actually what they call Medicare Advantage plans. So a Medicare supplement are standardized by Medicare, and they also call them Medigap plans. So one of the things with a Medigap plan is that you actually will need your prescription drug plan. So if you do have the Medicare and You handbook, I can tell you that you can actually look on page 76 this year. This is for 2023. It will show you what the standardized plans are for supplemental plans, and you will need a prescription drug plan. So that will be an additional premium. So you may have a situation or a family member have a situation that you might need some help paying for your Medicare costs. If your income is limited, you may need some extra help. And if you qualify, you may be able to have your Part B premium paid, or you may be able to lower some of your medication cost. And there are different programs to assist you. And again, it's important that you call the HICAP office. We can sit down with you and find out if you might qualify for these programs. Here's ways that HICAP can help. We can help compare the plans. We can help estimate your prescription costs. So we will get online with your medication and see which prescription drug plan is going to be the most inexpensive for you and the one that's going to cover most of your medications. And you can apply for low-income assistance programs that we just talked about, and how to meet your Medi-Cal share of cost if you do have a share of cost. We can also help you with billing issues and errors and appeals. I'm the community educator for HICAP, and so I actually go out to community programs and mobile home parks and the senior centers to explain who HICAP is and how we do things. One of the things I also do is talk about Medicare fraud prevention, which we're going to talk about in just a moment. Here's how you can prevent fraud. We talk about detecting fraud, and then reporting it. So to protect yourself, you have heard people say, please protect your social security number and your bank account numbers. And you also need to protect your social security number and your Medicare unique ID number. That is so important because you don't want to give it to somebody that is going to misuse it. You don't want to leave your Medicare number in a phone message. Don't carry your Medicare card unless you really need it at some point. And don't accept offers of money, free food, or gifts. You have to watch for incentives like it's free, and we know how to bill Medicare. And don't accept any offer of free services or supplies in return for your Medicare number. And don't accept medical supplies from door-to-door salespeople. They should not be knocking on your door. And Medicare will never call or visit to sell you anything. And don't let anyone convince you to see a doctor or service that you don't need. And I also want to suggest that you don't call the 800 number on TV that you will see during open enrollment with Joe Namath. That 800 number can inadvertently take you to a place where they ask you for your Medicare number and then enroll you in a plan and you will not have your doctor. That is really a difficult situation. So we recommend that you don't call those 800 numbers. And also in a personal way, I did get a call the other day. I answered it. It was on my cell phone. And the gentleman said to me, he said, do you have the new plastic Medicare card? And I was a little confused. I don't think I'd heard of a plastic Medicare card before. Normally, I would advise you to hang up, but my curiosity got me and I wanted to know more about this plastic Medicare card. And he said that he would be happy to send out the new card with a new number, but I would have to give him my Medicare number. There was no way that I was giving him that number. And I also told him that I have never seen in all the years that we've been doing this, a plastic Medicare card. So please don't fall for that either. So during open enrollment, you will probably be getting a lot more scam phone calls. And my recommendation and the HICAP recommendation and all the counselors say, just hang up the phone. So if you detect that you look at your Medicare summary notice, the bill that you got for Medicare, and you find some inadvertent charge on that and you want to find out about it, and it may say on that statement that there's a doctor that you know you didn't see, you want to call the HICAP office. You want to report it to us. Our number at 209-558-4540. There's also an 800 number that you can call too. So we want to sit down with you and look over that Medicare summary notice to make sure that you are not a victim of fraud, and it could just be inadvertently a billing error. So it's really important to protect your Medicare card, to detect if something's wrong, and to call us, to reach out to us. We want to assist you. So one of the things that we can assist you with is information. And we are, during open enrollment period, going to have meetings at these locations. We are going to be October 18th at the Gladys Lemon Senior Center in Oakdale, and that's at 1 p.m. We're also going to be in Patterson at the Hammond Senior Center on Wednesday, October 19th at 9 a.m. We're going to be in the Turlock Senior Center Monday, October 24th at 1 p.m. and Stanislaus County Veterans Center on Coffee Road at 1 p.m. At these forums, we invite the Medicare Advantage representatives to come and do a short mini presentation of what their benefits are and highlights are going to be for the next year, which will be 2023. We also ask that they don't pressure you, so this is not a sales meeting. We do not sell anything at HICAP, so we ask that these representatives also do the same things at these forums. But this is a perfect opportunity for you to ask questions and meet the representatives face-to-face directly with the Medicare Advantage plans that are in Stanislaus County. So these meetings are very important. We welcome you to be there. It's important that you meet these representatives, and this is going to really provide you with information that's going to be for the year 2023. So HICAP is the most reliable source of unbiased information, as I've said. Remember, we don't sell anything. There's no cost to see us at HICAP. We teach you about Medicare and explain your options so you can make an informed decision. That's so important. One of the other things that we're able to do is we're able to have satellite locations. We're actually in Ceres the third Wednesday of the month at the Ceres Community Center. We're in Oakdale the first Friday of the month. We're in Patterson on the fourth Tuesday, and then we're in Turlock every Wednesday. So if you call the HICAP office and you say, I would like to meet with a counselor, but I can't come into the Modesto location, which is on Coffee Road, you can call and make an appointment for these satellite locations that we have in Ceres, in Oakdale, and Turlock and Patterson. So again, calling us is very important. We're right by the Veterans Center, 3500 Coffee Road in Modesto. There's our number, 209-558-4540, Monday through Friday. You can also look us up on the internet at the Stanislaus County and Aging Veteran Services, and at the bottom it's www.agingservices.info. I do want to tell you that we talked about some CMS updates. When we first scheduled this with Kristen here at the Community Hospice, she said, will you have some CMS updates? Well, actually, after we spoke yesterday, they did come in. So I can share some of this with you. It's very important. Your Part B for the year 2022, you have been paying $170.10. Everybody's been paying that unless your income is a little bit different. So for the year 2023, if you have a pencil, you can write this down. The Part B is going to decrease by $5.20 to $164.90. So there will be a decrease in your Part B. So also, I know you're going to ask a question, well, how can they decrease it and then sometimes they increase it? Well, actually, there was a 2022 report that there's an excess in the Supplementary Medical Insurance Trust Fund. So they were able to pass that on to people with Medicare Part B coverage. So also, beginning in January 2023, certain Medicare enrollees who are 36 months past kidney transplant, they're no longer eligible for full Medicare, but they can elect to continue their Part B coverage of immunosuppressive drugs by paying a premium of $97.10. And that is so important because once many people that have had end-stage renal disease or been on dialysis and then have a kidney transplant, and then suddenly their Medicare benefits, once past the kidney transplant, they no longer qualify for. So this is important that they're able to continue for 23 months with their drugs. So I know at this point in time, there may be some questions, and I want to turn it over to Priscilla, who's here today. Kristen's at a meeting, so I want to say thank you, Priscilla, for having us here today.
Thank you. Thank you for being here and doing this presentation.
Yes.
We just had one question, and it said, do you have offices or know of affiliates who offer these services in Contra Costa County? And
Okay.
somebody responded, yes.
Yes, I know who that is. I held up the HICAP brochure before. There's an 800 number. If you have a pencil, I will give it to you. So if you call the 800 number, they will direct you to the HICAP office in your telephone prefix area or zip code. It's 1-800-434-0222. Again, that's 1-800-434-0222. So yes, there is a HICAP office in Contra Costa County. Absolutely.
There's no other questions in the chat box, but does anybody else have questions who's watching right now?
Well, I will share one more thing. At the HICAP forums that I talked about, we have a comparison sheet that provides a lot of information about each individual plan. We don't go into detail with transportation, eyeglasses, hearing, vision. We don't go into detail. That's what the representatives are for. But we will be having a new updated comparison sheet for the 2023 benefits starting October, excuse me, October 15th, when open enrollment begins.
I do have one question or a reminder. Sandy, if you can't get to the Modesto office and you want an in-person appointment, you can go to some satellite sites.
Yeah, I did mention that, and I'll mention it again. The satellite sites series, we're there on the third Wednesday of the month. So that's in series. We're in Oakdale on the first Friday of the month. In Patterson, we're there on the fourth Tuesday of the month. And then in Turlock, we're there actually every Wednesday. And we're meeting at the Turlock Senior Center. We're meeting at the Patterson Senior Center, the Oakdale Senior Center, and then in series, it's the community center. So yes, those are our satellite offices. So if you do call the HICAP office at 558-4540 and you want to meet with a counselor at the Turlock Senior Center, we'll make an appointment and there will be a counselor there to assist you.
Thank you.
You're welcome.
Thank you. I also wanted to say thank you for the good information. I know you were talking about the story of somebody calling you about the plastic Medicare card, and that's something I had never heard of. So thank you for sharing about that possible scam.
Well, that's actually, that plastic Medicare card is something I hadn't heard about. So, and we try to stay in touch with most everything that's going on, especially with Medicare, and had not heard of anybody having a plastic Medicare card. So literally all he was looking for was my Medicare number to use it for fraud.
Certainly. Well, thank you so much, Sandy, for being here and for participating. And thank you all for joining. If you need any additional resources, you can contact us here at Community Hospice at 209-578-6300, or you can visit the website at hospiceheart.org. I'd like to invite you to our next presentation, which will be on October 26th, and it's going to be how to cope after loss with the upcoming holidays. This video will be available on our Community Hospice YouTube channel. Thank you all for joining. Bye.